thank you. I'm not Malloy today, so that's good.
Right?
That's good. Just a little bit about myself. Okay, first of all, I'm a gynecologist, so you can only imagine that all the things that Khadijah talked about is what I have seen and heard for 40 years. I've been practicing for 40 years, and so you can imagine I've seen almost everything that can involve something that would make a woman feel uncomfortable. Okay, and I have to honestly admit that I never really associated directly that a lot of their problems could be related to something that they use every single month. Because I would have thought that the way our technology, that if there was something out in the market that could be possibly causing a problem, that it would have been off the market, okay? And little did I know until I got involved with Nspire, okay, that there was something that was better and that women basically have been more or less forced, okay, to use what's been out there. So that's been an eye-opener for me, because it makes it easier now for some of the symptoms that women come to complain about. I can start off by saying, hey, are you using pads? And I can talk about that and maybe educate them as to how those pads may be causing some of the problems that they've been having over the years. So from a gynecology perspective, this has actually helped me in my management and diagnosis of some of the problems that women come and see me about every day. Okay. And Khadijah did an excellent job. Actually, I don't even need to be up here, because when you really think about why does a woman use a pad, Khadijah showed you why. They use it for comfort. They use it because they have a cycle. They want that blood, okay, to be absorbed and away from them. Okay, so therefore, the fact that this is what they've had to use, because this is all that's new on the market, and this is now available. Actually, the presentation can end, okay, for all intents and purposes, because this is the reason, okay, that a woman uses a sanitary napkin. Now she knows she has something that's better. However, it's like, I don't know, what's the expression, icing on the cake or cherry on the pie, whatever, you know the expression, when it's something extra. The fact that a lot of the women, you've heard some of the testimonies, you've either heard them at presentations or you've seen them on the internet or Facebook, concerning how they've noticed that their cycles have changed, they're having less cramping, they don't notice the same odor or irritation, and then you have to say to yourself, okay, a pad is a pad, and okay, I'll accept the fact that it absorbs better, I'll buy that, but why should that absorption have anything to do with my cycles being better or shorter or not having the odor? So if you look at it from that perspective, you might be saying, okay, maybe they're exaggerating, maybe they're saying some things. No, that algae strip that she mentioned earlier, and she mentioned about the negative ions. Well, it's not just negative ions in that algae strip. There's something called far infrared technology, which I'll mention a little bit about in a second, and nano silver, okay, which is nothing but nanoparticles of silver, actual silver, it's like silverware, okay, silver that's impregnated in that little algae strip. Now even since telling you that, you're still trying to say, well, okay, you mentioned these three things, how could those things be making somebody feel better? Okay, so let's kind of go through it. Now, I'm not going to spend a lot of time, but I'm going to try to hit the most important points. Let's take the easy one first, the odor, okay? We know that silver, the element silver, okay, is a natural anti-infective agent. This is why when people had burns and they get sent to a burn unit, one of the first things they do is they put an ointment on the burn areas, and that ointment is called silverdene ointment, okay? Because they don't want any sort of infection to be in that area, whether it's virus, whether it's a bacteria, whether it's a protozoa, fungus, they don't want anything. And so when someone comes into the emergency room, they're like, well, what can we put on that we think can take care of everything? And it's been shown that silverdene ointment. So that nano silver just means nothing more than taking silver and breaking it down to 1/10000000th of a particle, okay? And therefore, because of nanotechnology, which means nothing more than being able to do that, they've been able to infuse silver into fabrics, okay? And that algae strip is like a fabric, so that nano silver is actually in that algae strip, so that when a woman is having a cycle, the reason she has that discomfort or that odor is because bacteria that's normally in the vagina, because it's supposed to be there, it keeps the vagina at a certain pH level, okay, which is important because in conception, that sperm has to be in a certain environment in order to get up into the uterus to impregnate that woman. So it's everything is scientific and it's supposed to be the way it is. So when I say bacteria, I don't want some people to think, well, no, there's no bacteria in my vagina. No, there's bacteria in everyone's vagina, but it is a purposeful bacteria. However, when that bacteria comes out of the vagina, now it's not in the environment it's supposed to be in. It's sitting, okay, on that artificial, okay, material, okay, with dyes and whatever other chemicals, and it's sitting right next to the skin. Now that bacteria isn't doing what it was supposed to do, so it's growing, and part of the process of that growth, okay, of the byproducts is why the woman notices the odor. Also why she notices the irritation. Okay, so that is why she has that. There's nothing wrong with her. She's not dirty. Okay, this is just a natural process. Okay, but unfortunately, because of the current pads in the market, okay, there's nothing that's really pulling that blood away from her. So it's like a necessary, what do they call it? Collateral damage. That's the expression. Mm-hmm. The collateral damage of her having a cycle is her having this odor, okay, because the blood is just sitting there, has no place to go. All right, so one thing that the nano silver does, in addition to, you saw the absorptive factor. So when the blood comes out in someone who's using a cherish pad, okay, first of all, the blood's being taken away from the body. That's the first thing. It's not even being allowed to sit there for a period of time. Now, of course, when it comes through the vagina, it's going to be there for, it has to come out, but at least when it comes out, it's being absorbed. But you have that nano silver on that algae strip to help fight any bacteria that may have come out with that cycle, and therefore that helps with the woman complaining of discomfort, irritation, and the odor. So that's easy, the nano silver part. Okay. All right. Now, you have also heard of women speak about their cycles being shortened and less cramps. So again, you're saying to yourself, well, how can a pad cause somebody's cycles to be less, okay, or cramping to be less? Okay. The far infrared technology and the negative ions sort of work together. Let's spend a little bit of time on the negative ions. There are negative ions in this room. Okay, the negative ions outside. Now, there are more negative ions at a mountaintop. There are more negative ions at the beach. There are more negative ions in your shower when you turn the shower water on. So the air is composed of negative and positive ions. The positive ions are the ones that come from primarily electricity. Okay, your computer screen. Okay, your air conditioning in your car, the motor from this fish tank, okay, your cell phone. Those are positive ions. What you notice when this pet odors in your house, someone's smoking a cigarette, any of those are positive ions. And the positive ions, what makes you feel uncomfortable. No one likes just living around cigarette smoke. No one likes living around pet odors, okay? So therefore, that is what makes you feel uncomfortable. This is why maybe at the end of a day, when you're in front of a laptop all day long, okay, and you're feeling a little drained and drowsy, it's because those positive ions have gone into your body and have basically made you feel drained, okay? But negative ions do, and it's very simple. They do two things. One, they combine with the positive. So the positive and negative get together, and then they fall to the ground. I mean, they actually are removed from the air. So if you can infuse the air with more negative than there is positive, the net result is that there's going to be more negative. Okay, and the more negative, what negative ions do medically is they actually go into the body. Okay, they actually expand the blood vessels and cause the tissues in the body to actually receive more oxygen. Your oxygen is transported by blood, okay, from your heart, goes to your brain, goes to the other organs of your body. The more oxygen that you can get to those organs, the healthier and the more functional those organs will be. Okay, so this is why when you're in that environment of negative ions, okay, you feel better because you've actually invigorated the body with oxygen to the tissues that make you feel better, primarily your brain. Okay, primarily your brain. Think about it. What is a stroke? A stroke is nothing more than lack of oxygen to the brain. Okay, and therefore, what happens? Those tissues die in the brain, and the person loses function. Okay, now you have negative ions that do just the opposite. They expand the blood vessels. They allow more oxygen to tissues, and this is why you feel better. This is why, as she already mentioned about the beach and the waterfalls, but artificially, when you take a shower, this is why when you step into that shower, okay, it may take 5 or 6 seconds, usually doesn't take much more than that, you feel totally different. Okay, so all you've done is you stepped into the shower. You're the same person you were a minute ago, okay, but you feel, it's almost like a euphoric, good feeling, and that's because you have artificially induced negative ions into your system. Okay, now another one, that's from the shower. You can also, and hospitals do this, they sell what's called ionizers. Okay, ionizers are infusing negative ions primarily into the operating rooms, into the recovery rooms, into the ICUs. When I say ICU, I'm also including the CCU, the neonatal ICU, all of the intensive care units, okay, in the hospital, and they do that for a reason. Why? Because they want the blood vessels in the body to get as much oxygen as possible to help with healing. Okay, so therefore, ionizers, okay, it's nothing new. Okay, Nspire didn't come up with anything new. They took beneficial technology, okay, and said, hey, let's utilize it with something that could help how the woman feels during her cycle. Okay, so ionizers, negative ions, it's nothing new. It's just something that has been applied to make that pad even more beneficial as far as the other effects that women talk about. Okay, that's negative ions. Okay, now the far infrared technology, that's a little more complex, and sometimes, because that's not something you hear every day, people using that terminology. But it's nothing more than thermal heat, okay, that actually comes from even our own bodies. When you've heard about the hands-on or healing, okay, each of us actually emits far infrared technology. And you can just say far infrared, okay? If you take your hand, heat actually comes from your hand and goes into another person. Okay, so that hands-on, and you're thinking, okay, I wonder how that really works. It's because you're actually sending energy, okay, into that person, okay? And so that energy does two things, okay? One, it actually penetrates. I mean, they've actually been able to measure the temperature on the skin, okay, up to a certain distance where they've actually measured the difference when you have far infrared technology being applied. What that does, okay, it's almost like an anti-inflammatory. Okay, it's almost like if you could imagine, if you could take a Motrin and make it a vapor, okay? If you could take Motrin and make it a vapor and send that Motrin vapor into the body, okay, how it would make you feel as far as cutting out some of your inflammation, that essentially is what far infrared technology does. Now, again, it's nothing new, nothing new. They've been using that technology for years. They've put it into belts, okay? They've put it into arm bracelets to treat a carpal tunnel. They've put it into belts where people have noticed that their menstrual cramps are less from using it. They've put it into blankets, okay, where people who had insomnia, they were feeling better and able to sleep better, and all the stuff that I'm talking about, okay? If you go on the internet, okay, and look and see where reputable institutions, okay, we're not talking about somebody who did this in some little box in some little country in the middle of nowhere, okay, you will see where they've used this technology effectively to treat, and especially inflammatory conditions, but they're starting to look at whether or not it could also treat cancer cells. Okay, they're looking to see if this particular technology can actually alter some of the cancer cells. So far infrared technology, again, is nothing new. It's been around, it's being employed in other areas, but it is helping to explain why women talk about in the testimonials their cramps being less. Okay, I mean, the average woman who's having cramping is probably taking maybe an Advil or an Aleve, or she's taking ibuprofen or Motrin. Okay, all of those are nothing more than anti-inflammatories. That's what they are. They're basically super aspirins. Okay, well, that is essentially what far infrared technology, except it's in the form of heat. It's actually in the form of heat that's penetrating into the body. Well, let's face it, if it's on the pad and the pad is next to the vulva, okay, and the uterus is just a few inches away, okay, you can understand how women could experience less cramping at the time of their cycle. And the area where they speak about the cycles being less as far as duration is because if you take the far infrared and you add it to the negative ions, remember what I said about the negative ions, how it increases the oxygenation to the tissues. So you have an anti-inflammatory, you have something that's giving some extra blood flow to the uterus. Now, we're not talking about blood coming out of the uterus. We're talking about actually making the uterus healthy, okay, which means it's helping the uterus heal faster, because a cycle is nothing more than the lining breaking down and trying to heal. Okay, so now you have something that's increasing the speed of that healing, and you have something that's cutting down the inflammation of that discomfort. That's why when you hear these testimonials, my cycle being shorter, my cramping being less, there is an explanation. Okay, Khadijah was not in any way trying to say that cotton from the pad, okay, or is going to cause somebody's cycle to bliss. No, the fact is that cotton, the blood is pulled away from the body to cut down irritation. The nano silver is cutting down any of that odor and discomfort. You have the nano silver, far infrared technology, just making her feel that we have an option, and not just an option. We're not talking about should I buy a Honda or a Toyota, okay, because they're both cars taking. No, we're talking about an option to help your health, okay, to help your life. That's a big difference, okay, as far as, just one or the other, okay. To me, this is, look at the difference. Look, Khadijah mentioned it. Look at the difference just in the color. Why should there be, all she put was water. She didn't put lemonade, okay, she put water. Why should there be a difference, okay, in the color of these two ingredients? Why? Obviously, there's something in here that simply adding water to made it change. Okay, well, that means it had to be some kind of chemical of some sort. The problem is we don't know what the chemical is, because the fact that it is considered a medical device, no one really has to tell us what's in there. Okay, they don't have to. Okay, and I can't, and the law is the law. Okay, so I can't knock the companies that don't tell us because they're not required to tell us. Okay, and they surely aren't going to tell us something if they think it might scare the public. I'm not saying that it would, but I'm just saying if they felt that it would, then they're not going to tell us, and they don't have to tell us. So sometimes you just have to kind of use that old-fashioned common sense and say, this is absorbing better, this is changing colors, why should I use that? Okay, when I have an alternative. So just anything else I'd be saying would just be redundant and additive, because I think that Khadijah has basically just doing her demonstration, tells the average woman why they should be using the cherished pad versus the competitor. I'm just kind of up here just to add a little bit to the science behind why the women feel the way they do, while using and after using the pad. Any questions?
I do. I just want to make a statement or ask you, in your studies, as far as the chemicals that's involved with the traditional pads in the store, pads and tampons. I know one main chemical that everybody kind of knows about is the dioxins that's in those pads and tampons. What do you feel as far as how, I guess the manufacturers say that it's such a small amount of dioxin, so the consumers don't have to be worried? How do you feel about dioxin levels in the pads and tampons? Because someone would say, hey, it's in food, so it's okay. What do you feel about the dioxins being in the traditional pads and tampons?
Okay, well, you asked an excellent question, and I want to answer it with a statement that's going to make it even sound worse than the question you asked. The manufacturers didn't even say that. The FDA, who we are relying upon, to protect us, they are the ones who said that they didn't feel that there was enough dioxin, to cause a problem, Okay. However, look on the FDA website and see if there has really been a controlled study, to show what is safe and not safe. We don't know what's safe and not safe. I mean, the fact that it's almost like if I say to you, there's a minute amount of strychnine in the water that you're drinking. Not enough to hurt you, but we know it's a poison. We know it's a poison. We know it has the ability to kill you, but we don't quite think there's enough that will kill you. Now, I mean, that doesn't give you any sense of security, because you will still feel, well, why should I have to have any strychnine going into my body? Why any? Forget about what amount, because no one knows what other factors may be going on in your body. What amount of dioxin may tip the scale to cause a problem? We all are not the same. Our diets are not the same. And so why have any amount of dioxin going into the body that is a carcinogen? Carcinogen meaning it can cause cancer. There's no ifs, ands, or buts about it. Dioxin is a carcinogen. So to say that there isn't enough that is of concern, is somebody saying, well, hopefully, that's really what they're saying. Hopefully, it will not cause you a problem. But the fact that I don't know what else you may be doing, I don't know your genetic makeup, I don't know, if it does, it probably wasn't dioxin by itself, So the problem is the fact that there's something that's bad, that in itself, should be a reason why it should not be allowed, unless you've done a controlled study to show that it cannot cause a problem in anyone. Okay, don't do a study saying it won't cause a problem in 70% of the people. Well, what about the 30%? Don't tell me 90% of the people. What about the 10%? And who are the 10%? Okay, so that's something that the FDA has not done. And you were talking about chemicals, because dioxin is not the only thing. Okay, just the fact that you have something that allow this to turn yellow or turn non-white, okay, just the fact that you have that blue dye on the strip that Khadijah showed you, that's a chemical, okay, and the fact that we know that that's getting absorbed, and so the combination of those things definitely could be causing a problem. It's definitely not organic cotton. We know that. There's nothing in that pad that's there right now on the market that is organic cotton. Okay, so the fact that it's not means it's something synthetic. Okay, and something synthetic has the ability to get into the bloodstream, and no one knows for sure exactly what it will do. Okay, no one knows, but we definitely know it is not healthy. Okay, we just don't know what it would do. And even though there have been attempts at legislation to kind of force the FDA to have some studies done, okay, it is not going anywhere. Okay, so the fact that anyone would even present that in legislation means that obviously someone has had a concern. Okay, and someone has asked the regulatory body, okay, that kind of controls things, to please look at that. But before it can even get to that, it has to kind of go through certain steps, and you actually need to have Congress actually say, here's what we would like to have done. So FDA doesn't have to. No one's putting any pressure on them. They've classified this as a medical device. And let's be clear here. A medical device, according to the FDA, just has to be able to do what it says it does. It doesn't say it has to do it well.
Wow.
It just has to say it does what it do. It does what it do. That's all it has to say. In other words, when they look at a pad, the pad is catching blood. Now, they don't have to say how well it has to catch it. Okay, it catches it. Okay, and that's all they have to say. Okay? Because it's not like taking a medication that's going to get rid of a headache. Okay, no. Okay, so as far as they are concerned, okay, it is doing what it was scheduled to do. Okay, now whether it could be causing some other issues, they're not really forced to find that out, because that's not what they're being asked to do, okay, as far as giving the okay for a sanitary napkin. They're not asked that, okay? It's like a hairdryer. Okay, we have no idea maybe if that hairdryer, okay, could be emitting some rays, okay, that could be causing some problems, okay? I mean, we don't know. No one, and I am not standing here to allude that a hairdryer does, but we don't know if a hairdryer can, adds to somebody's Alzheimer's, okay? We don't know that, okay? And the FDA has no obligation to look into that, because the hairdryer, okay, is there to dry the hair. And if the hairdryer is drying the hair, then it is meeting what the manufacturer said it's supposed to do. Okay, so nobody can make them look into that. So that's kind of where we are with those authoritative bodies. So that's why we almost as grassroots, okay, because that's kind of what this has become, a grassroots movement to better our health conditions. Okay, so focus groups like this, okay, the internet, Facebook, the conferences that we have, okay, the presentations that we do, the TV interviews, the magazine interviews, okay, it's to educate people about an alternative.
My secondary question to that, and I know you're highly respected in the community as a practitioner, gynecologist, doctor. So I want to take my hat off to you for that. You probably brought me in this world. No, seriously. I think he had a hand in bringing me into this world. But I want to say too, I know that you deal a lot in the black community. Okay, with the hysterectomies being performed, I know that the African American woman is highest in numbers. Uterine fibroids, she's the highest in numbers. Is there any studies or what do you feel possibly could be contributing to that, or what?
Okay, and that's an excellent question. And as a researcher, and as a gynecologist, and as a teacher, I have to base answers like that to that question based on research, okay, or based on what they call evidence-based medicine, okay, EBM. We are not exactly sure, okay, all the reasons why women get fibroids, okay. We know it's multifactorial. We know there's not one reason. We know some of it's genetics, some of it may be diet, okay, some of it may just be lifestyle. Okay, we don't know. Now, some of it may be exogenous influence, okay, by chemicals, okay? We don't know for sure, okay? And it'll be very difficult. Well, I won't say very difficult. It would be an arduous task to take women. The only way you could really do this would be to take women who've never used a pad or a tampon, or have used organic, okay, materials, cotton, and then take women who have and see if there's a higher incidence in these women developing fibroid tumors. The problem becomes you've been able to control that aspect, but you haven't been able to control maybe diet, genetics. So all we know is that anything that can get into the system, okay, we know has potential to cause a problem. Can I stand here today in front of you and say that the napkins that are in the pharmacy and the grocery stores are contributing to fibroid tumors? I cannot say specifically because there have been no studies that definitely prove that. I can only say that we are well aware of the fact that there are ingredients in these napkins that are not healthy. And the extent of them not being healthy, okay, we don't know. Now, we may, with time, find out, okay, because there haven't been, like I said, there have been no studies and no one's been really forced to look into that. So what we have to say to ourselves, we actually will become our own study. Because if we have our adolescents, okay, using these pads, and we notice down the line that there are fewer hysterectomies because of uterine fibroids, or any of the other endometriosis, okay, or ovarian cysts, or inflections, okay, or what I call vulvitis, which is inflammation of the lips of the vagina. If we notice less of that, less women going to the gynecologist because of pain, okay, infertility being improved, less infertility, okay, going forward, then we can look back and say, I wonder if it was related to those napkins that my mother, grandmother, and great-grandmother were using. So it's one of those things where we'll have to kind of go forward, okay, and seeing, okay, if we see improvement in those areas. Now, they do know, take dioxin. They know dioxin is a carcinogen. But dioxin, in addition, okay, this is one of the chemicals, they know it's also been associated with endometriosis, okay, which is nothing more than some of the lining that's normally inside of a woman's uterus. That's where it's supposed to be. When that lining leaves the uterus, usually via the fallopian tubes, okay, it's supposed to dry up. But when that lining stays alive, when a woman has a cycle, she's now bleeding outside of her uterus, because that lining that would be bleeding inside the uterus is now bleeding outside the uterus, and therefore that contributes to a lot of the pain that women have who have endometriosis. Now again, they've associated dioxin with that. They've also associated dioxin with thyroid conditions. Okay, they've also associated dioxin with just what I call general medical health issues in general. So it's, even though we know it's a carcinogen, we also know that dioxin and some of the other chemicals, okay, can cause other problems. Okay, so to answer your question, okay, no, I cannot, even with my research and everything I've read, say specifically that it's related to the fibroids, but we don't know. And probably going forward, we'll get some education from that.
Sometimes it comes down to, why would you even take the chance?
Right.
I mean, as a father, as a parent, why would you give these pads to your children? You know, knowing the risk, it's not even worth it to even see, because those case studies that they're doing probably will never really happen. We just know that they're using, once they get off the traditional product and get on to Cherish, they feel better. That's all we need to know, really,
that's it.
for the most part.
It doesn't, you know, it's that old expression, yesterday is history, tomorrow is a mystery, today is present, okay? And that's why they call it a gift, okay? So my thing is, we can't do anything about that. We can go forward, okay, with the knowledge that there is something safer and healthier, okay, for women to use, because they have to. You know, not that they have to. I mean, let's face it, it's not that they have to. You don't have to brush your teeth. You don't have to take a bath or shower. But let's face it, the majority of people do. Okay, so this is something that they're going to use.
This thought just popped up in my head. Okay, so